and welcome into To Your Health. You know, if you live in the state of Alabama or just about any place in the country, we're learning one thing in the area of medicine is that we have a shortage of people in the medical profession, even doctors. So some organizations are trying to do something about it. One of them is right here on Auburn's campus. Today we have with us the Senior Director of the VIA College of Osteopathic Medicine at Auburn,
yes.
Meghan Woodham.
Yes,
and
nice to meet you. Yes,
Glad to have you here with us
Thank you
today.
very much. Appreciate it.
You know, first our viewers need to know that a person becomes an osteopath, a doctor, right? In some cases you heard the term DO.
Yes.
Right.
That's correct.
Explain what that is all about so they know that these are really doctors.
They're absolutely really doctors. They can go be any type of doctor that they want. There's no limitations on them. They practice in all 50 states across the country. You know, a lot of DOs tend to be primary care physicians, which is where our greatest shortage is.
Amen.
But they can be neurosurgeons. They can be cardiologists, whatever type of physician that they want. But we're really proud of the fact that, especially at VCOM, that we're able to put out high quality primary care physicians that are practicing in rural areas where they're really needed.
And the school that you have at Auburn right now has been there at least 10 years.
That's correct, yes.
Right.
Yes. So VCOM actually started in 2003 up in Virginia, which is where our first campus was. But when we opened down here in 2015, we've been on Auburn's campus since then and been graduating students, you know, putting those folks back out into the community to practice medicine.
And of course, you're located on the campus.
We are.
And you interface with the school, with the university,
yes.
But you're an independent school.
We are. So we have a great partnership with Auburn. We are very excited about the ongoing work that we have with them. Our students are really glad that they get to have all of the access to the student activities and things. And our folks in the research department do a fabulous job of doing research projects across all types of disciplines with the folks there at Auburn University. But we are a separate college and we do operate independently from them.
So are you basically a postgraduate school?
Yes. So our students will go and complete a bachelor's degree from an accredited university anywhere in the country.
In some kind of a medical field or?
Most of them, yes. Not all of them. Some of them, you know, they just have a passion for medicine, but they also have a passion for something else. And so they may study something differently in undergrad. Now, they all come in with a very strong science background.
Yes.
But, you know, they'll have a bachelor's degree and come in. Some of them have been out in the workforce, maybe been a nurse or an EMS, EMT, something like that. But they'll come in, they spend 2 years on campus with us doing preclinical coursework, learning all of that basic science stuff, working through our systems curriculum. And then in years 3 and 4, they go out and do clinical rotations. It's a community-based model for their clinical education where they rotate through different specialties, most of them being primary care. But they also rotate through emergency medicine. They can rotate through any type of medicine that they're interested in, psychiatry, OBGYN, peds, any of that type of stuff. Once they graduate from us, they are officially a DO. They are a doctor of osteopathic medicine. And then they will go through what's called match. So they match in the spring, usually in the March timeframe, into whatever type of specialty they want to be in. So that would be, you know, again, family medicine, internal medicine. And they'll go through a residency training. It's what we call graduate medical education. And that can last anywhere from 3 to 7 years, depending on what their specialty is.
Yes.
Right. And so once they've completed their residency, they go out and they start practicing medicine just like any doctor. And
what people don't really realize is that when they become a resident, they're no longer a student. Per se, they're a doctor.
They are. They're absolutely a doctor. They're getting specialized training in their specific type of medicine. So they see patients. They have what are called attending physicians, who are doctors that have been practicing for a number of years, who are overseeing them. So they are still learning. Really and truly, if you're a doctor, you're always learning.
Right.
You're always a student.
Yeah, because obviously medicine is just such a changing thing now.
Oh, absolutely.
And in this area, doesn't a DO kind of look for more of the natural cures?
They look for a holistic approach to
Yes.
medicine.
Yeah, okay,
So
that's the
they're gonna
term.
the holistic approach, yes.
Mm-hmm.
So they're gonna look at not just the symptoms and treat the symptoms that you may be
Mm-hmm.
experiencing with whatever disease process you're dealing with, but they're gonna look at environmental factors. They're gonna look at what is
cause.
the cause,
Yes.
the root cause. They're gonna look at the structural pieces of your body. What is your musculoskeletal system doing? And they have specialized training in how to treat those deficiencies. They're going to look at your nutrition. They're going to talk to you about your social and family background and what type of support you have. So they're going to look at a whole picture when it comes to taking care of you as a patient.
That's a wonderful way to do it.
Absolutely.
I mean, that should be the way we're doing it from day one in our lives.
I
So that
agree.
we really build a great base.
Right, and that's really what they're about. They want to do disease prevention instead of treating something once we catch a cold or something like that. We want to build a case for prevention and not just treating a disease.
So
once
if
it's
somebody's viewing this show and they want to get some information about the school,
Yeah.
we'll put the information up on the screen.
Fantastic.
Because obviously, if you've got a child or you've got a grandchild, because a lot of viewers of my show have grandchildren, and they need to get them into a wonderful area that they can really make a difference. And this is
Absolutely.
truly an area where they can make a difference.
Absolutely.
So they can, if they're in college right now and they want to move in your direction, then they can reach out to your college and see about getting in.
Yeah, we'd love to have them, tour them around campus,
Great.
Introduce them to some of our faculty, our students. They love to talk about why they picked VCOM and why they're
Great.
here. So yeah, that would be wonderful.
Well, thank you so much. And just remember, it's another wonderful way that Auburn is working in conjunction with other organizations to be able to give us the best in the area of healthcare. We'll be right back right after this.